Hi, hope you're all doing good. So far we've covered around 200 questions in NEET MDS 2019 paper discussion series of videos. So in this final part, we'll cover the rest of the topics. So rather than going in depth, I'll just give you the list of topics which are remaining because of lack of clarity in questions and unavailability of options. I'll just give you the list of topics so that at least it will be helpful for you to review these topics if at all you're planning for NEET MDS 2020, right? So the remaining topics, apart from those which we discussed so far: treatment of progressive caries, types of fluorides, passivation, which element is used or which metal is used for passivation, and antibiotic prophylaxis. If at all a person or the patient has orthodontic implant, you're planning for extraction, so which antibiotic would you prefer? Myoepithelial cells, location of myoepithelial cells, common gastrointestinal infection, finish line. We have questions on finish line, blood transfusions, acute type respiratory failure, test for brittle materials, various properties in dental materials. Also questions on hemoglobin, myoglobin, drugs in candidiasis, oral candidiasis, healing mechanisms, image based question with tongue grip, CBCT, drawbacks, root canal treatment. Why do you go for cuspal reduction, and or in which conditions or in which pathologies in specific do you go for cuspal reduction after performing root canal treatment? Also there was a question on PNAM, pre-surgical nasoalveolar molding, various agents in pulpotomy, hierarch appliance, sublingual drug, oral cancer markers, dry hardeners, porcelain veneers. And also there were questions on carbohydrates, iodine pump, muscarinic M3 drug, pseudosis, cleft palate closure techniques, special receptor theory, pulp pressure, osteoporosis, delayed wound healing, copper content in amalgam. So these are some of the keywords which we received from several aspirants pertaining to NEET MDS 2019 question paper. So we tried to decipher as many topics as possible, and we could cover at least 200 questions, and these are the remaining topics, right? So I hope it's useful. So wish you all the best. Love you all.